Hi, everybody. Welcome to the Vital Conversation, where myself, Dr. Eli Camp, and Dr. Letitia Dick are talking about the axioms of our medicine. Hi there.
Thanks for being here, Eli. This is great to do this with you once again. And we're doing this monthly, going through the axioms. And this has been a great journey so far. I think we're about halfway through.
It has been awesome.
Yeah.
You know those principles of naturopathic medicine that all the schools have hanging up and all that stuff. They're true for us as well. Someone had sent me a text after our last Axiom conversation and said, "What about the principles of naturopathic medicine?" And I responded and I said, those are principles that can be applied by any field of medicine.
Hmm.
The axioms are what make naturopathic medicine, nature cure, make it what it is. We use those things to practice our medicine. I just want to remind everybody that is so important. You have to know why. Why do you do what you do? And the axioms tell us why.
Right, right. This was a journey that I know you and I were tasked with by Jim Sensenig, um, and others. He mentioned many times to other docs too. There's something more about naturopathic medicine that's deeper than the principles, because even allopaths can say they're using those principles. So there's something deeper. What is it? What is it? And we would go back to Lindlar, and we would go back to Knipe, and we'd go back to these other books, and we would look at the philosophy and try to tease this all apart. And so it's been a journey to find these axioms of nature that the world runs on, that we rely on, because they don't change. They're always there, and that's how the body heals. It's how we use these principles in our modalities that makes us naturopaths. It's because we understand that, and we use that to invigorate the vital force. It's
Did we
amazing.
record that? That was really good. I love how you just said all that. I'm glad we're recording this.
I'm glad we're recording it too. I know sometimes we talk off camera and get into these things too. So I'm glad
Yes.
that one was caught. Um, yeah, well, let me go back to Jim's quote, because this is the basis of why we started this journey. And his quote just says it all. And I'll say it each time we do one of these axioms. Naturopathic medicine is based on universal principles that are true and hold true for all time. We don't have to change what we're doing for the 21st century, because the same rules and laws that apply to nature and the natural process of healing are immutable. And they are. They will be there for all time,
Mhm.
whether we use them or ignore them. But if you push against them, boy, that pushes back. So you don't get very far,
No,
right?
not at all. Like walking up a slippery glacier, right? Where you
Yeah,
start sliding backwards. Yeah.
yeah, yeah. Um, Today's axiom is minimum dose. And the ones we've gone through so far, I'll just review. First one was the Vis Medicatrix Naturae, their healing power of nature. The second axiom was health as balance. The third one was suppression. The fourth one was individuality or individualization. As Jim would say, that's the doctrine of snowflakes. The fifth one was doctrine of signatures. So today is minimum dose. And I actually had a little issue with this one, because as I read Linlar, there were many things that linked into minimum dose in so many ways. Law of resonance, law of similars, law of attraction, law of polarity. I had a hard time just saying this was minimum dose. So I know we've got a lot to talk about on this one today. Yeah.
Well, I
This is
wonder as we talk about this if those other names for the elegance and the need for minimum dose, like the law of polarity, that's not an axiom, right?
I don't know if it is or not. I mean, I've found it all through Linlar. Um,
I think it's minimum dose. I think you made the right call for sure.
yeah. So that's where I always struggled is like, is there a 12th or a 13th axiom? Do we do law of polarity and law of resonance? Is it harmonics? Is it anyway? I get
It
stuck
can
in the weeds.
evolve over time, the way
Yeah,
homeopathy has, and herbal medicine and hydrotherapy. Like all of these things have evolved over time, and we can totally do that. We're the first people to codify these and own them.
right. Yeah, it's never been done. It's never been done in this manner, which is just kind of mind numbing. But I know you had these conversations with Dr. Sensenig. I had many also. We would bat these around a lot, and it was they were always fun discussions, you know. But I can tell you that my little Linlar book is so tabbed with stuff I can't keep. I just, anyway, it's just nuts. There's a part here in Linlar I wanted to read. I was skimming through it again last night. It's under chapter 7 called Laws of Cure. And I love that. There's this chapter called Laws of Cure, literally. So he says here, failure to understand this fundamental law of cure accounts for the confusion on the part of exponents of the different schools of healing science and for the greater part of human suffering. Nature cure philosophy never loses sight of the fundamental law of cure. While allopathy regards acute disease conditions as in themselves harmful and hostile to health and life, as something to be cured, we say suppressed, by drug, ice, or knife, the nature cure school regards these forcible house cleanings as beneficial and necessary. Necessary so long as human beings continue to disregard nature's laws. That is it right there.
Mm-hmm, mm-hmm. So, I'm wondering before we jumped right smack into the middle of minimum dose,
Mm-hmm.
these there's a subset of laws that need to be pulled out, perhaps. Because they actually underlie a lot of the axioms when you think about it. So, for instance, polarity, resonance, and attraction. These are
Right.
forces, right? These are it could be the forces of nature. We have gravity, we have like all kinds of stuff. And these specific three require the minimum dose, the minimum
Mm-hmm.
intervention. Let me actually change the word dose to intervention. They require the minimum intervention, in my humble opinion, to work their most effectively. Right? If something, think of attraction, think of magnets as a concrete example. It doesn't matter how small the attraction is between the two poles of a magnet, they're going to come together. It can
Mm-hmm.
be minute. We might not even be able to measure it, but if
Mm-hmm.
it's there, boom, it's together. And it's the same way with polarity. The smallest repelling force that exists will cause them to have to overcome tremendous obstacles in which to attract. And resonance, oh my gosh, resonance is everything. Like
Right.
spinning top, it's either smooth or it's wobbly. And if you're not in harmony and there is no resonance, your top is wobbly. And in the person world of health, wobble equals symptoms of illness. So minimum dose, you don't need much to write a top. You don't need much to attract. You don't need much to repel at all.
Mm-hmm.
So that's what I think. They're forces of nature, which may fall under some subset of the laws and forces of nature, because we have Herring's law, laws of healing, and there's a number of laws.
Uh-huh.
They're
This is
not
great.
axioms, right? Because those laws apply to all the axioms. I think
Mm-hmm.
I should do this over a glass of wine or a strawberry
Well,
daiquiri.
what's so hard about separating these out and actually just kind of listing them in a list is that they all interact so tightly. It's so hard to discern, are we really talking about dual effect? Are we really talking about minimum dose? Is it instead law of similars? Is it law of resonance? Is it law of polarity? And as I read Linlar, it just all blends into one giant thing.
Yeah.
And here I am trying to list it out into individual things. And we can see these truths in other writings. There's many other brilliant writers out there. And then when you see it, you go, that's that, you
Yes.
know? And it's
Yes.
really neat when you come across it. But to to like tease it apart and get the strands all sorted, it's just my mind just jumps from one to another constantly, and I have a hard time doing it.
Well, that's why we're doing these conversations, right? Is to, I think, talk about it and give clinical example of it. I think of the axioms on the physical plane, and I think of the forces of nature on a quantum plane, because they're like crucial, but you can't really wrap your head around them to use them in healing. You need the axioms to guide you in being the nature cure doctor. It's just these forces are underneath it. I think you were brilliant to do it the way you did with minimum dose.
Okay. Well, here we are with minimum dose. What I had written before when I presented minimum dose in the talk for the Vital Gathering a while back, um, I wrote, what is the least we can do to correct the problem? The physician strives to use the least number of medicines in the smallest possible dose as infrequently as possible to encourage the desired outcome, which is the restoration of health. And that can be, like you said, Eli, earlier, everything from homeopathy to herbal medicine to hands-on care like Bowen therapy to it's always the least is more. So,
Because here, so I'm so happy with this. I'm going to make a little social media post for it. When you work with the body to heal it, no matter how powerful the intervention, how strong, less is better, because it's like pushing a raft downstream. It's already going there, like with one finger, right? Your 4-year-old could just move it along.
mm-hmm, mm-hmm.
That's why you don't need much if you're doing it the right way for the right reasons.
Exactly. Because you're working with the vitality, you're working with the momentum that's already there, that you've established the ability for the healing process to happen. You just give that little raft a nudge, and there it goes down the river.
Yeah,
Yeah,
that's why it's so
yeah,
beautiful.
it is.
You
Really.
said earlier that Hahnemann really delved into this whole idea of minimum dose. And I had said we have to make sure, like you just mentioned, all of those. Minimum dose does make you think of homeopathy, but when you think the the minimum intervention, the less is more. I think that's how I'm going to start thinking of it now in my head.
Mm-hmm. Mm-hmm. Yeah, it's like you don't have to have like super high doses of a botanical. You can use just, like essence flowers. I mean, you can use minimum amounts of an essential oil. It doesn't take much because, it's almost like those things are like pheromones. It doesn't Did you know, this is interesting, off topic a little bit here. In a whole lifetime of a woman's body, the amount of estrogen she makes fills up 1 teaspoon. We think all this estrogen is surging through us and that there must be like gallons of it or who knows what. But in a lifetime, it's a teaspoon. So hormones are like our pheromones. You just need a little bit, a little bit. Same with essential oils. You just need a little bit. Same with homeopathy. You just need a little bit. Same with acupuncture. You just need that needle in that one little spot. So,
If you're assisting the body in its ongoing healing attempt at that moment.
Correct.
If you're using something to suppress, man, I bet you jump way up the scale, right? In how much you need.
Well, that's why you have to have these medical drugs that are so powerful. You've got to have, if you're going to suppress, man, you've got to use, an army to suppress that immune system because it's so strong. So when you have someone you're treating with an autoimmune disease, and the medical thinking is, oh, that metabolism's gone haywire, you just have to stop it. Don't let it do that. Don't let it get inflammation in those joints. Let's just stop that inflammation. It takes a lot of power to stop that inflammatory process because that's the natural healing process of the body telling you there's a problem here and we're trying to work on it.
Mm-hmm.
So those drugs, those immunosuppressant drugs and now the biologics that they're using are so ungodly strong. I don't know how people even survive through those drugs and sometimes they don't, right?
No, sometimes they don't.
Especially with cancer therapies. So it's a whole different ball game when you start supporting the body to heal, and you don't have to use much, but you are more consistent and aggressive in the therapies, mm-hmm. Not necessarily stronger therapies. You're just more aggressive and consistent with the therapies you're mm-hmm. using mm-hmm. to treat people with cancer or autoimmune diseases.
So it's like the raft has hit a stagnant place in the river, and it's like an eddy pool, right? And it's not continuing to move. So we have to come along and give it a little bit more to get it to go. So I have a question for you. So to bring in, this is sort of a clinical thing, because someone called me and they said, I'm working with another doctor called me and said, what would you do? And I said, well, okay, I can only tell you what I would do, not what you should do. She's like, okay. I was like, she has a patient with a fungal, is it SIBO? It's something, she wants to use nystatin. Maybe it's a candida overgrowth or something. So she wants to use nystatin. And she said, of all of the drugs that I could use, this one's going to get the fastest effects. And so I want to use this and then go back to nature cure. What would you do? And I said, okay, well, I've not ever used nystatin. I asked the question, what about this person's body does this fungal agent find attractive? What about this person's body does it like, and therefore it's thriving? And what is the body trying to do to make itself less hospitable? And what are you doing to help the body? So if you're eating a lot of sugar and your lifestyle choices are feeding or making your body a really friendly place for this organism or whatever, or you're taking something or eating something or whatever, it's going to continue to be there. If you give it nystatin, kill it off, but you still have a body that it likes, it's going to come back, right? It's going to flourish again. And so I said to her, what I would do is figure out, either how to help the body. And in my mind, the way to help the body is to make it inhospitable to this growing other life form. We don't want it there. So what does it not like? It doesn't like a healthy body.
Right.
Okay. So to me, that's a sort of an abstract example of minimum dose or least intervention. But it's also at the core of what we're supposed to be doing. So I wanted your thoughts on that. What would you have said?
Well, very similar. Boy, now I got a family member wanting me. Hold on. I'm
Okay.
gonna get that. Um, very, very similar. I mean, you have to change the terrain so the critter won't live there. It's not like you're going to attract you. And sometimes we have to, kill the critter. So you pull out things out of your hat that will kill like a candida infection, like grapefruit seed extract or artemisia or something. So you're using something to knock back the infection, but you have to change the terrain, because even if you kill that fungus or something, but you don't change the terrain, something else is going to come in its place.
Mm-hmm.
So you have to change the whole environment so that you don't regrow a similar kind of problem.
So you could use nystatin while you are correcting the terrain, because I've read about nystatin. It does seem to be relatively benign in most ways.
It's a higher intervention. I usually will go for grapefruit seed extract and
Me too.
probiotics and things like that. But um,
I like
actually,
oregano oil as well.
yes, actually, oregano oil. I was going to say in 30 years, I don't think I've ever, in 30 something years of practice, I don't think I've ever used nystatin. I always use the botanicals or
Mm-hmm.
other means with
Yeah, I haven't
hydrotherapy.
either.
Yeah. And so it is about changing the terrain. And it's like, why does that person have that? Why are they have the opportunistic environment for that critter. So it's about changing that environment inside them,
Mm-hmm.
right? And then what is in their life that's causing that stress or that miasm, I'll say,
Mm-hmm.
that's attracting that to them.
Mm-hmm.
Yeah.
Yes,
Really.
polarity, resonance, and attraction.
Yeah.
What is there? Yeah, what's happening at that level?
Mm-hmm.
Oh,
Mm-hmm.
good. Well, I feel like, well, I've just totally learned something from you, right? I don't jump right to treatment, but I also could move people along a little bit faster. Like I don't even jump to the oils or the herbs. First I try and shift for at least a month, right? I'll try and shift what they're doing that's creating it, because for some people they have such a vibrant vital force that's for some people that's enough, but if it doesn't resolve, then I'll kick it up a notch, like Emerald says.
Yeah. Yeah. So for some people, that's all you have to do, is those basic things. And they never have a yeast infection again, or they're totally fine. But other people with chronic conditions, or they're in that environment that they just can't get out of yet, or for whatever reason, um, yeah, you have to kick it up a little bit.
Mm-hmm.
Yeah.
It is, to me, one of the greatest tragedies in medicine that the normal state of being of health is not the highest ideal for all healers. They think it is. They think it
they,
is, but
they think it is. That's the hard part, is they think it is, they believe it is, they've been taught that it is, and that's their paradigm they're in.
yes, yes.
Mhm.
But true health, if true health was normalized, and that's what you were always trying to achieve, was that state of true health, not a body without symptoms, I think medicine could shift. Maybe this is like what centuries old feud that's going on.
Yeah, that's the core of the difference between naturopathy and allopathy right there. It's that, and that's why so many allopaths don't understand us. It's like, what are you doing? That's not medicine. They don't even consider us part of the medical field, because we're not, suppressing symptoms and treating that person and making that go away. It's like,
Mhm. We have lock picks instead of big heavy hammers and swords and catapults and guns and cannons, we have lockpicks, which are so elegant and leave no damage behind. And yeah.
Right. And the person just gets better and they heal. And it's magnificent to watch. It's amazing to watch. That's why I just keep doing what I do, because people come back to me and, well, I don't have that stomach. I just had a young gal in the clinic yesterday. I hadn't seen her in 3 months. It was her 3-month checkup, just changing her diet and doing these things. Her acne had totally cleared up. She hadn't even complained about that. And I said, so I go through her list of symptoms. So how's your stomach ache? Oh, I don't get stomach aches anymore. And her mom's like, no, she hasn't complained of her stomach at all. That was a chief complaint. And I said, so what about this? Or what about this? Oh, no, wow, I don't have those symptoms either. It was just really neat
Go
because,
down that list. Yeah.
yeah, then to the young girl, it's like, well, I am really a lot better. She hadn't really put it together. And her mom's like, see, I told you. So it's fun, and it's fun to get the young people to understand, what the healing process is and things.
So we got an email that came in a few axioms ago and I forgot about it. It's very relevant to today's conversation, so I want to share that with everybody. So this email is from an associate who has felt a longing and a calling to practice naturopathic medicine a different way. And she heard a couple of vital conversations and realized that this is what she wants to do. This is how she wants to practice naturopathic medicine. It was what she was looking for when she came to school. So she's been in practice a little over 20 years. And she joined and she has started studying and she is still in practice, right? And she sent in this question for you and I to answer for her. She does prescribe. She's learning a lot of this stuff, she feels like, for the first time. And she's kind of at a loss of what are maybe a few steps that she can start doing right now to transition her practice and her patients and the way she's practicing medicine away from what she said, I'm very allopathic, but it's all I was taught to do and all I know how to do, to nature cure. And she's asking about that transitional journey. And I think it's a great question.
That's a big question. And I think it's something that all of us need to be looking at, because that's ultimately our goal, is to re-grab these docs that have naturopathic degrees, but don't know nature cure, never were exposed to that in their clinical practices, haven't had that even mentored to them in their teaching clinics. So they don't know what they don't know. And that's really the reason why NMI exists. So how do we engage these doctors to bring them up to speed with our medicine, in our true sense of medicine? And I know that in the fall, we are starting with mentorship with the program through NMI to hands-on support these doctors through the process of learning with us, back through the vital gatherings where we have recorded and we have produced all this material in a way that it's a curriculum. And so we're going to be enrolling doctors in the fall into a curriculum-based mentorship with senior vitalists to teach you and coach you through it. That's the best way that we've come up with so far. And maybe there's other ways to do it, but that was the purpose of doing the vital gatherings and recording all that information.
Mm-hmm. Yes, awesome. I think as a companion to that, we might want to consider like a very short 1-page sort of overview of how do you get started in making this transition, like
Mhm.
listen
Mhm.
to these vital conversations specifically, then do this vital gathering, then sit down and evaluate your practice and see where you can start to make changes that you can, one, afford to make, that you feel like you have the knowledge to make, uh, that your current patient population might be open to and actually hoping that you would bring to the table, right? People are often seeking true nature cure, but they have a hard time finding that. But still, naturopathic doctors uh, offer something different than what they can find from their established healthcare team. And then from that point, you get to the next set of vital conversations, vital gatherings, and some training, some additional training, whether it's hydrotherapy or the Carroll method or dark field if you want to do dark field, or iridology or eclectic botanicals. Like you get use your CE requirement to learn something you can then go incorporate in the next step of the journey towards becoming more nature cure. And over a short period of time, most people, it takes them less than a year, from what
Yeah.
I'm understanding, a year to make a big transition. And then they have this need for mentoring. So now what do I do? Now, how do I do this? I would have done that at one point. I'm not really sure what to do now
Mhm.
and still keep it within nature cure. And that's where that mentorship program is going to be invaluable, I think. But
Yeah.
don't you think that there's things people can start today doing?
I believe so. And I believe that we have that listed on the new website. I'm not sure of this, so don't quote me, but I think you can start with some basic vital conversations, especially the beginning ones with Jim Sensenig, and the philosophy. You got to start with philosophy. And there is a subcommittee of us working with um, planning this rollout of the mentorship and the enrollment into the Vitalist track. So at the end, you will get your Vitalist certification and be a VNMI. So that ultimately will then give you the tools to practice these therapeutics and modalities, understanding nature cure and the laws of naturopathic medicine in a way that supports healing with your patients. And really excited about that. So if you're listening to this and you're interested in that, look for that from us. Notifications coming out shortly here for the fall.
And I'm
Yeah.
so glad that you listened to your intuition and joined NMI and then sent in that email to say, okay, so now what? Because it's a great question. So now what? It's a
So
great
now what?
question,
Yeah.
right? When I used
Yeah.
to tell my patients, okay, no gluten. I'm sorry, you have celiac. You have to come off gluten. They're so excited to have an answer, and then within a day or two, they're like, okay, now what? Now what do I do? Right?
Mm-hmm.
Um, I think the axioms should probably, these recordings we've done should probably happen early as well. I think it'll give a lot of foundation for the things that come. And I'm so glad we're recording these.
Yeah. Okay. As you can see, I'm making notes here as
I know,
president.
I see you. I see you doing
Oh,
that.
try to axioms come early. Okay. Yeah, because we're in the planning stages of rolling out this curriculum in a more succinct way. We've had it there all along, but it hasn't been clearly delineated how you go through the process of learning these things. And so now we're making it more of a package and mentored through the process. So you get to pick our brains, us as senior vitalists, you get to pick our brains a bit
That's
as
so
you go through the
valuable.
process. Yeah, yeah. It's
A lot
neat.
of the NMI members that came on in the beginning had the great fortune to work with Tom and Jim and Jared and you and Chris and Dan and all these folks that we could learn directly from, like to be mentored and to learn. Um,
Mm-hmm.
and we've captured a lot of that. Thank goodness.
Thank God we've been doing this.
Oh
This would have been
man.
lost, Eli. We have, what, 6, 7 years of documentation of all of us senior vitalists lecturing and speaking and showing, Dr. Tom Cruzel demonstrating his hands-on work. It's like that was super cool.
That
I
was
mean,
super cool.
there's so much there that we've captured and preserved, and thank God we have. Um, thank God we have, because we would have lost a lot.
Mhm.
Yeah.
We did it well, especially making a welcome space for more eclectic homeopathy, which is
Mm-hmm.
powerful modality. And I think at one time in history, the people who are classical pure just homeopathy had issue in using other things. But that happened 200 years ago as well. More
Yeah.
than that. If you read, right, I read this part, it was in Lindlar. I can't tell you which one. I don't have y'all's amazing ability to recall the book or the page or the chapter, but it was one of the early sanatoriums that they set up,
Mm-hmm.
and they were nature cure. And then
Yep.
homeopathy came on the scene. And I remember this paragraph that I read, and it said, well, of all of the things coming to us from MDs or from the medical doctors, from that establishment, homeopathy seems the least benign or the most benign and the one that might have some promise. And they welcomed homeopathy into their therapeutic tools. And I thought at that moment, oh, wow. So they actually haven't always been lockstep with one another.
Have not. And it was really interesting when my father went through Western States Chiropractic College and got his naturopathic degree. He told me a story. He says the only experience he had with homeopathy was there was a guest lecturer who came in and was going to teach homeopathy. And what he was talking about was there was actually a crop that had a pest infestation, and that they actually took that. I'll say it's a grasshopper. I don't know what it was. They actually took that critter, potentized that little insect,
Mm.
sprayed it on the plants, and then the plants didn't have the infestation anymore. That was my dad's experience with homeopathy. So he didn't even know how to use it on people. He just knew that there was this thing where you potentize something and you use like cures like. And so you threw that insect remedy on that plant, and then the plant doesn't have the insect infection anymore. And he was always wondering, like, how does that work with people?
Yeah.
Until my dad met Bhagat Singh. And Bhagat was a homeopath who came from India and was teaching all these naturopaths at the time. This was probably 1960s, 70s, about homeopathy. So my dad enrolled in a homeopathic course. I have his little certificate. I think he flew to Florida several times a year or something to train with Bhagat. And then dad came back with a giant homeopathic cabinet with, thousands of remedies, and dad suddenly was using homeopathy. And I remember that because I was like in junior high. I was like, Dad, why are you giving me these little pellets? I don't know what these are.
Right.
so that was Dad's regenerating homeopathy into naturopathic medicine. And then my dad went on to study Chinese medicine. When President Nixon opened up our barriers to China, and he wanted doctors to go in and learn Chinese medicine. My dad was part of the medical group that went in and into Taiwan and Hong Kong and learned acupuncture. So then he brought acupuncture back into our practice. And so, that's the beauty of naturopathic medicine, is we can use all of these modalities, and we understand how to use these modalities in the context of nature cure, in the context of these laws and axioms, because we get the philosophy and we know why we're doing what we're doing. Yeah.
That I have not heard that story before. That is so awesome. That is
Yeah.
awesome. I would have paid money to watch your dad do an acupuncture on somebody. I bet he was very meticulous and very specific and very uh just detailed about it, you know?
Yeah. Yeah, he was very, my mother was incredibly afraid of needles, so she forbid him to bring the needles home. Like, you don't do that around here. So I think he would actually schedule patients kind of after the normal hours and do it and stay late because she didn't want her to know that he was doing acupuncture in the clinic. But
Oh,
he used
that's
a lot of seed beads. He'd put little beads on people and things like that. Yeah,
oh,
it's
that's
funny.
awesome.
I know. Family.
Well,
Yeah.
I see minimum dose throughout, or at least intervention throughout all of this, all of these modalities. I like what you just said. We can learn new modalities, right?
Mhm.
We can learn a cold laser, but are you using it to assist the body in its job that it's already doing? Are you trying to suppress?
Right. Right. Now, sometimes you need to suppress. I'm not saying
Yes.
that that's not part of healing. Sometimes you've got to get things under control,
Yes.
and that's okay. So just know that you're doing it, know why you're doing it,
You're
right?
preserving life.
Yeah, exactly.
Yes. Yes. Well,
So,
for those of you who might still be using a lot of stuff because you're early in your journey, keep faith, have hope, reach out, keep asking, keep learning, because everything you shift to into assisting the body to heal itself, you'll never forget that, right? It's like riding a bike. You learn how to do that, and then you don't have to do things you don't want to do anymore.
hmm hmm yeah, it's and a lot of it is just remember you might not know what you don't know. So be curious, be open, be willing to ask questions. And the more you understand why maybe this vitalist practitioner did it this way, you don't understand why. It's like ask why. Because when I started working with my father, he was not a good teacher. He didn't verbalize why he was doing things. And I would look at things and go, wait, I grew up with this medicine, but I don't totally get what he just did.
Right.
So I would go and say, Dad, why did you do that? He goes, well, you just do it. I'm like, well, that doesn't help me at all. I don't
Right.
understand. And so I would try to figure it out. And so I'd ask him a different way. I would have to ask a different way. And the thing was, I didn't understand. I didn't know the context.
Mm.
I didn't understand the context of why he did it. And then it was only later that I started realizing, oh, there's this whole, it's not just he just did this one thing. There's this whole thing he's doing.
Mm-hmm.
It's the diet. It's with hydrotherapy, with homeopathy. It's all these things. It's not that he just did that one thing.
Right.
And
Right.
he picked that one thing because it fit the person at that time. It might not fit another person. I was still somewhat thinking allopathically. It's like, well, don't you use this herb for every time you see this? No, you don't.
Right.
You don't. You individualize it for the patient care. And that's what it took me a bit of working with him, a couple years to go, oh, I get it, because I was still trained in naturopathic school in an allopathic model. And that's the frustrating thing, that even me growing up with naturopathic medicine in a clinical setting in our teaching school, in teaching facility, was still allopathic. And it took me a bit to shift it and go, okay, I get it now. So it took about 2 years for me working with Dad before I understood that.
I didn't realize that. See, I had this sort of image of you growing up and like just your dad explaining all this stuff to you in depth. And no, no.
No, I grew up making his herbal capsules. I grew up getting hydrotherapy whenever I was sick. I grew up, taking bitter herbs and things like that. But he never taught me philosophy. He never taught me why he was doing the things he was doing. I was just kind of immersed in it, right? And it wasn't until I started reading Lindlar going, oh, this is exactly why Dad did this. Because my dad learned from Carol, who took the training from Lindlar. So the naturopathic clinic my dad set up was a complete mimic of Dr. Carol's practice, which was a mimicry of Lindlar's clinic.
Mm-hmm.
And so that Lindlar philosophy and approach and care for patient management is directly brought down into my clinic now.
Mm-hmm.
And it wasn't until I was reading Lindlar, and thank God Lindlar was part of our philosophy class at Naturopathic Medical School. I don't think many, if any, of the curriculums now even use Lindlar at all. And I understand that Dr. Jared Zeff didn't even get Lindlar in his training. He learned it from my dad.
Right.
And so when Dr. Zeff came up with the therapeutic order and those things, it was because he had been watching and mentoring with my dad that he wrote these things down. But I can tell you that Jared's philosophy, Dr. Zeff's philosophy of the therapeutic, what's he call it? The
therapeutic order.
No, it's the healing. Shoot, I'm blanking on what he calls it. The method of healing where the body, there's a disturbance and it brings it back into balance. That is actually in Lindlar. It's written in the book here. This is part of Jared's flow chart that he puts together. It's all in here. But Jared didn't learn it from Lindlar. He learned it from my dad, who learned it from Carol, who learned it from Lindlar.
That is really cool.
It's really cool. When I read this, I'm like, oh my God, this is the healing pattern that Jared had written down. So that I use that diagram all the time in lecturing and teaching. So
yeah.
So, to go back to these incredible healers of the past, and thank God Lindlar wrote down philosophy volume number 1. And volume 2 is therapeutics. And I don't remember what volume 3 was. I think there's 3 volumes to that book, to that series.
There are. Yes, it is. The natural therapeutics, the philosophy. I must not have the third one.
I don't think I have the third one either. I was looking here. Hold on.
I don't think Jim talked about it very often. Not often enough for me to buy it.
Yeah, and I don't know that it's so I have volume 1 is philosophy.
Yep.
Volume 2 is natural therapeutics.
Yeah. I'm going to look in the book and see if.
And I don't know if there was a 3. I assumed there was a 3. But anyway.
Yeah. Right. So dietetics, yes. Dietetics and iridology, iridognosis.
Okay.
So there are 4. That would make such a great book set to raffle off, wouldn't it?
That would be amazing. And Eli, do you know, I know we're going over time here, perhaps.
No, we're good. We have 8 minutes left.
Okay. Do you know if there is still ownership on this, or is this general?
Oh, is it public domain yet? I don't know.
This was published by the Maidstone Osteopathic Clinic in 1975.
Okay, well, this was done by the C.W. Daniel Company. I would bet you this can be republished. Right? Yes.
We should republish all 4 volumes.
Yes, and write a foreword that includes the Axiom.
Yeah. Well, I had Lindlar's son. Do I have this correct? Is it Lindlar's son? had a clinic, and I have his book.
Mm.
And he also had a radio show. And
Mm.
what I've done with his book, I'll have to find it, is I tabbed it and I was starting to write edits or comments through his information. I would love, and I think that one is public domain. I would love to republish that one with Vitalistic comments on it.
Mm.
I'll make a note here, look for other book.
Every time we talk, we generate work for ourselves.
I know, right?
But
Like,
it's because our brains are going and going and going and going.
well, it's such a passion, and I know I have some autism spectrum problems, and so it's like it's like this focus thing that happens. But anyway,
Since we have a couple of minutes, I don't think we elucidated this 100% and give some examples. And then if y'all have questions, put them in the Vital Conversation chat. But in some of the specific areas like herbal medicine, if you can use a few drops of something instead of a few ounces of something, that would be an example of less intervention. Or with hands-on physical medicine, can you do it with a gentle non-force technique versus cracking the bones all over the body? Food, smells, can you do it with a slight aroma? Does it have to like knock you out kind of aroma? Just those kind of examples are what we talk, or what I think of when I think of the least intervention. Do I have to do 10 things, or could I do 3 things? Yeah.
yeah. Jim always said, he said, understand what is the lowest common denominator.
Mm-hmm.
What is the least you can do to get the biggest effect? And he said, this is like in every other aspect of life. We look at this, we look at efficiency. And he would say, I took this from his lecture, he would say things like, even with a profit margin, right, in business,
Mm-hmm.
or even with gas and mileage, you want to get what is the most efficient a way to do this with the least amount of expense or effort. Yeah. And I know, like, example with hands-on work, sometimes a manual adjustment is what needs to happen to get that rib in place or whatever. But I have had that work happen just with Bowen therapy, which is a very gentle adjustment on the fascia, basically. It's a fascial move, and cranial sacral therapy and things like that. I was taught by Ozzie Wrench with Bowen therapy that we were working with someone who had an injured tailbone. And the tailbone move is you put a lot of pressure right on the tailbone, and you hold another point, and then you just do a move over the tailbone. You just like, it's not even like you're pushing the tailbone, you're doing a move over the fascia of the tailbone, and the tailbone will readjust. But this woman she cracked her tailbone. She couldn't sit down. She was sitting on the donut thing if she could even sit. And so he told her, listen, if this is too much pressure, and he barely put pressure on her tailbone and she was already crying. He says, okay, I can do this without touching you. And it was amazing because with intention, and he put his hand where he would put it, but above it. He was actually like 2 inches above her, not even touching her. So he put his hand there and held that point, and then he over top of her, about 2 inches above that tailbone, he did the move, and she felt it.
Wow.
She goes, wow. And he didn't even touch her.
That's awesome.
And then he said, well, get up now and see how you feel. And she's walking a little easier. And he says, well, okay, go ahead and sit. See if you can sit down. And she's like, she sat down without pain. And it was like so quick and so elegant. And he didn't even touch her.
That is amazing.
And it was all with intention. It was so cool. Yeah. So I'll never forget that.
I would have given her Bellus perennis. That's what I would give her Bellus perennis. But that's even less. That's even less than the homeopathy. I love that. I'm always looking for that.
Yeah.
I used to
So,
wonder, can I think it? Could I just think it and help? I know that sounds weird. I'm not saying I have a
oh,
magical power, but thought's powerful. Could I think it? Like, I
hmm.
don't, we'll talk about that some other time.
Well, I think that's one of the axioms of intention, which is coming up. That's number 11.
Oh, good. I'm
So we'll
excited for
get
that
there.
too.
But yeah, I think there's so many things that less is more, and that's really what the minimum dose is about. Yeah.
Well, this has been awesome. Thanks everybody for listening, and we'll talk to you next month.
All right, guys. Take care. Bye.